What a beautiful morning. So grateful that Trump got in office. Life is going to be so much easier again.
A few moments later.
So I just got the quote from the dentist in Mexico I've been looking to go see because, no offense to my current dentist in the United States, I love him. He does a really great job, and I wish I could go to him. I just can't afford dental care in the United States.
Own the libs. Are you winning yet?
Yo, what's up, everybody? Welcome back to Mind Mirror. Today, we're diving deep into the devastating reality of medical debt in America and the truly heartbreaking consequences faced by those who voted against the very systems that could have protected them. We're talking about people begging for help after life-altering medical bills crushed them, rural hospitals shutting down in red counties, and the crushing realization that the policies they supported are directly harming them. Let's get into it.
Morning, Bappo crew. It wouldn't be Monday morning if it wasn't just another day where MAGA voters are losing their mind over something they did to themselves. Let's look. The residents of Curtis, Nebraska, which voted for our friend the orange turd for almost 86% of the voters, are now bitching and moaning because their hospital is shutting down because of uncertainty over funding. That's right, boys and girls. If you don't know, the Medicaid bill, it wasn't cutting Medicaid completely, right? When you know a little bit about the business, it was really cutting funding for reproductive services, duh. It was cutting funding for any form of permanent residents or people here legally who already had access to Medicaid. Illegals cannot get access to Medicaid, so stop that shit right now. And more importantly for these folks, it cut funding to rural hospitals. I'm not going to celebrate this, but I am going to say you get what you voted for, and you fucked around and you found out. And this is sad, and people are going to be losing.
Okay, let's be absolutely clear here. This clip is showcasing a situation where folks are facing severe consequences because of policy choices. The speaker is directly linking the hospital closures to voting patterns in Curtis, Nebraska, a place that overwhelmingly supported a particular political figure. And now that hospital is on the brink of shutting down due to funding uncertainty, impacting the entire community's access to healthcare, it's a stark reminder that voting decisions have real-world repercussions that extend far beyond Election Day. And the narrative being pushed is that these individuals are experiencing a direct outcome of the political landscape they helped create. It's a tough pill to swallow when you realize the decisions made at the ballot box can lead to losing essential services like a local hospital. This isn't about celebration, it's about acknowledging a painful reality where political alignment might have led to healthcare access being jeopardized. And the message is loud and clear. You reap what you sow, especially when it comes to your community's well-being.
Their healthcare and access to healthcare and having to drive a considerable distance just to get to a hospital. But this is what you voted for.
Part 5, the end. It's been 3 months since the warrant has been issued for your arrest because of an unpaid medical bill. You are in your new apartment, money is tight, you are barely scraping by. You wake up late for work one morning and you rush out the door. You are driving too fast to get to work and you see those lights in the rearview mirror. As you are pulled over, you're upset because you really can't afford a speeding ticket right now. The cop walks up, asks for your license and insurance, and takes it back to the patrol car. A few minutes pass, and as the cop walks back to your window, you pray you're just getting a warning. You are surprised when the officer asks you to step out of the car and tells you you are under arrest for an outstanding warrant. You are arrested, charged, and placed in county jail. The only way out is to pay the collection agency $2,200, but you don't have that kind of cash. Neither does anyone you know. And that's how and why you've been in county jail because of a medical bill.
What a beautiful morning. So grateful that Trump got in office. Life is going to be so much easier again.
A few moments later.
So I just got the quote from the dentist in Mexico I've been looking to go see because, no offense to my current dentist in the United States, I love him. He does a really great job, and I wish I could go to him. I just can't afford dental care in the United States.
Own the libs. Are you winning yet? No, because you played yourself. These are the females who lack the spine and the courage to step into a private voting booth and vote to safeguard their own rights as women. They're so weak that they actively participate in their own downfall, allowing men to use them as tools to strip away their own rights and help strip away the rights of us all as women. This is what happens when you're gullible enough to fall for the conservative patriarchal illusion of a traditional family, where the man is supposed to be the leader, but in reality, that so-called provider is a failure, leaving you, his wife, so financially helpless that you are forced to rely on the very people that y'all demonize and cheer to be deported just to survive. Now look at you crossing the border into Mexico. Yes, the same Mexico you clutch your pearls over just to be able to afford health care. You're out here bragging about voting for Trump, yet you can't even afford to put America first under Trump. You're out here fighting for white supremacy, but white supremacy ain't fighting for...
This is a powerful moment that cuts right to the core of hypocrisy. Here we have someone expressing frustration that the very ideology they championed isn't protecting them when it matters most. It's about the disconnect between espoused beliefs and lived experiences, particularly when it comes to personal well-being and financial stability. The speaker is highlighting a situation where individuals are seeking basic necessities, like healthcare, from places or systems they might have previously critiqued. It really makes you pause and consider the complex web of beliefs, political stances, and personal needs, and how sometimes the things we advocate for don't always translate into tangible benefits for ourselves or our communities. This moment serves as a poignant illustration of that disconnect, urging us to think critically about the real-world impact of our political allegiances. It's a call to self-reflection on how our ideals align with our practical realities.
You make it make sense. And the best part, this is just a warm-up, so buckle up because the real struggle hasn't even started yet.
These Trump supporters are finding out the hard way. In Pemiscot County, Missouri, where nearly 3 out of 4 people voted for Trump, their only hospital is now at risk of closing. It certainly doesn't take a rocket scientist to guess why. The hospital, Pemiscot Memorial, relies on Medicaid for about 80% of its revenue. It's the only place people can go to in an emergency. One mother rushed her toddler there after she had an allergic reaction and said that if the hospital wasn't nearby, her child would not have survived. The bill that Republicans passed not only included Medicaid cuts, but new work requirements too. 80 hours a month, and that might sound doable in theory, but in rural counties with limited jobs and little public transport, it's just an easy way to kick people off coverage. The nonpartisan Congressional Budget Office says 10 million people will lose health care nationwide from this, including 170,000 in Missouri alone. Imagine voting to kick yourself off of getting health care coverage. I couldn't, because I didn't. And even with all these cuts, the bill still adds $3.4 trillion to the national deficit. So yeah, people who voted for the guy who said he was going to protect working Americans are now watching the one place that's supposed to protect their health get pushed towards bankruptcy. Even Senator Josh Hawley said that Medicaid shouldn't be cut, and then he went ahead and voted for the bill anyway. Way to stick up for the people of your state, Josh. When the policies that you support start closing down hospitals in your own community, it's probably time to rethink who you're backing.
I am an uninsured American, and I had a trip to the emergency room about a month ago. I got the bill yesterday, and I just want to go over some of these charges with everybody. IV therapy for 1 bag of saline, $935.78. Laboratory services for a blood draw, $1,352.75. CT scan imaging, $3,986.63. Emergency center charge, $2,218.08. Pulmonary services, $34.70.
$9,000 for a single ER visit. That's just criminal. She's breaking down the bill, and it's absolutely mind-blowing. $1,000 for a bag of saline, over $1,300 for a blood draw, nearly $4,000 for a CT scan. This isn't healthcare. It's a predatory business model disguised as a necessity. These prices are inflated to an insane degree, making it impossible for anyone without top-tier insurance or immense wealth to afford basic care. It's no wonder people are drowning in medical debt. This is a direct pipeline to financial ruin, and the sheer absurdity of the charges, like that saline bag, shows how little regard there is for patient affordability. This is the system, folks, designed to profit off of sickness and desperation. It's a system that leaves people vulnerable and desperate, facing impossible choices. And it's happening to everyday Americans who just needed a little help.
6 cents. Pharmacy services for Benadryl in my IV was $192.74. Cardiac services, $610.83, for a whopping total of $9,331.57.
So I saw this guy that posted a video earlier, basically just asking healthcare workers, are we okay? And in short, no, we are not okay. The healthcare industry is so incredibly broken at this point in time. The pandemic showed large hospital systems that they can save so much more money at the expense of their staffing ratios and their patients. And it is truly heartbreaking. And I could create an entire new series on just healthcare system in general, but I also don't like to go too in depth because I don't want to lose my job. And I am happy where I am right now. However, no, the healthcare world is not okay.
Oh, but Donald Trump ended the war in Gaza. Aren't you thankful? Of course. Of course. Thank you, Donald Trump. Thank you. I have no problem giving credit where credit is due because I don't worship any politician. See, that's the cool thing about that. I sincerely hope and pray that the people who have been afflicted by this horrible violence that we have helped fund, by the way, because we've been helping fund genocide, that they can receive some type of normalcy in their lives and move on, if that's even possible. What I think we actually need to look at is the amount of money that we send to Israel every year. Meanwhile, Israel has free healthcare.
This is a crucial point that gets overlooked in the national conversation. The speaker is drawing a sharp contrast between the resources allocated to international aid for healthcare and the struggles Americans face domestically. It raises serious questions about national priorities when other countries benefit from robust healthcare systems funded by our tax dollars, while many here are left without adequate coverage. This highlights a perceived imbalance, where external needs seem to be prioritized over the well-being of our own citizens. It's about understanding where our financial contributions are going and whether those allocations align with our domestic needs. This perspective encourages us to critically examine our nation's spending and advocate for policies that directly support American healthcare access. It's a call to reassess our global financial commitments in light of our internal healthcare crisis. This is about ensuring that our resources are first and foremost serving the people of this country.
Our government can't even vote to lower healthcare costs for us. The Republicans actually want to make it higher because if those subsidies end, which is the whole reason that we have this government shutdown going on, everyone's premiums are going to skyrocket. So Israel's getting free healthcare on our dime. Meanwhile, we are drowning in medical debt. Israel has free higher education. Meanwhile, we are drowning in student loan debt and gutting that education department. So I think we still have bigger fish to fry.
Medical debt and medical issues, health issues, are the number one reason why people are in debt. It's not just the hospital bills, the medical bills, the bills from all of the other clinics that you may have gone to from a variety of creditors. It's the fact that you probably had to take time off of work for any treatment that you went through, which means if you're an hourly worker or if you basically even are a W-2, you were on some sort of FMLA leave, and that does not mean you get paid your full salary, or you had to go on some sort of disability, and disability is not your full salary. So what happens? You begin to rely on credit cards and personal loans. You're trying to pay down the medical bills because you have to keep going to those medical facilities, and then you're trying to keep up on other bills as well. It's one of the main reasons people file.
There has been a very significant change in the American healthcare consumer in that they put off care.
Exactly.
And they don't get care, even for chronic situations.
Yeah.
Patients can't afford to go to the doctor when they have diabetes or kidney problems or those kinds of things. They don't go because they can't. They can't afford it because their employer bought them a $10,000 or a $5,000 deductible.
Right.
And as we talked about before, and if we haven't said it on this, healthcare debt is crushing a huge number of people in the United States. It is one of the major causes of bankruptcy for individuals in the country.
The thing that most frustrates me is we are strangling American innovation. We are strangling our ability to have art.
He's articulating a perspective that often gets missed in the healthcare debate. The idea that our current system isn't just about medical bills, but is actively stifling potential and creativity. When people are forced into jobs solely for health insurance, rather than pursuing their passions or starting businesses, that's a massive loss for society. Think about the artists, the entrepreneurs, the innovators who might be sidelined because they can't afford to risk losing their coverage. This isn't just about economic inefficiency, it's about a fundamental restriction on human potential. We're living in a society where fear of losing health insurance can dictate career paths and life choices. This is a significant barrier to progress and personal fulfillment. Trapping people in cycles that don't necessarily align with their aspirations, it's a system that prioritizes corporate stability over individual ambition and societal advancement, and that's a tragic outcome we need to address.
Artistic people, musicians, because they have to go into jobs that will give them health insurance. And when I was Senator Andy Kim's state director, I had so many conversations with constituents who are struggling to pay bills because someone in their family got cancer or got sick. And so medical bills are something that get in the way of every single American, and I want to get rid of that. We are the most richest country in the world, and we should not have a situation where people are going into debt because they can't pay medical bills.
So I'm a little fired up this morning. This is going to be a little bit of a rambling rant. I saw a TikTok video yesterday by a woman talking about her own frustration with medical debt. Her husband got a diagnosis of pancreatic cancer, wasn't able to get any Social Security benefits, and they burned through their savings and went into debt for his care. And she is now saddled with hundreds of thousands of dollars in medical debt, and she's lost her husband. Now, this is something that I think everybody should look up. Just get on the Google machine and Google medical debt. And what you will find is that this is a unique problem to America. In fact, the number one reason for Americans to file bankruptcy is medical debt. I'm going to say that again. The number one reason for Americans to file bankruptcy is medical debt. And out of 33 industrialized nations, 32 of them have universal health care, and in all 32 of those industrialized nations, medical debt is not a thing. No one loses their savings or their retirement or their homes to medical bills. Medical bills actually affect people who work in healthcare. So I've gotten messages from nurses and medical assistants and physical therapists and doctors who have experienced medical complications and medical bills and problems paying their medical bills. Even I, as a physician, have had a problem with this. I used to work for a federally qualified health center. I did not make very much money. In fact, I did not make enough money to cover the interest on my student loans, which is part of the reason why I left. But a significant factor in that was while I was working for that clinic, I got acute appendicitis and ended up in the emergency department. I knew all the nurses that took care of me in the ER and in the OR. I knew the surgeon personally who took out my appendix. And we got a medical bill for $4,000, which we could not afford to pay in one lump sum. So what did we do? We arranged a payment plan. And immediately after making the first payment on that bill on time, I was sent to collections. A doctor who...
This anecdote is absolutely infuriating and speaks volumes about the flaws in our system. A medical professional, someone deeply embedded in the healthcare world, facing collection for a bill he was actively paying. It illustrates how the system can be unforgiving, even to those within it. His experience highlights the arbitrary nature of some medical billing practices and the aggressive tactics employed by collection agencies. Even for someone who understood the system, the outcome was punitive and stressful. This isn't just about a doctor, it's a microcosm of the broader struggle countless individuals face. It demonstrates that understanding the system doesn't necessarily shield you from its harsh realities. The fact that a payment plan, agreed upon and adhered to, still led to collections is deeply troubling. This situation underscores the systemic issues at play, where financial penalties can outweigh established agreements. It's a clear sign that the system is broken and in need of significant reform.
Worked in a city and knew the entire staff of the hospital was sent to collections for a medical bill that he had actually paid on time according to a payment plan prearranged. That is our healthcare system. It is completely broken. Universal healthcare should be a thing in this country. And if you aren't voting for it, you are voting against your own self-interest, and it will eventually get you too.
I'm filing bankruptcy this week for a husband and wife who have to file bankruptcy because the husband had a really good job, but then he lost it during COVID, and then he had to take any job he could get. You know, we could take any job we can get, and the only job he could get didn't have health insurance, and that turned out to be a real bummer for him because he ended up having a massive heart attack 2 years ago, and he had $47,000 in medical bills that he'd been paying on monthly for the last 2 years. He ended up going on Social Security disability because of his heart, and now he has Social Security, and he pays everything above and beyond what it actually costs to pay his utilities and buy food. And oh, by the way, they're eating ramen noodles because he really wanted to pay those doctors. He was so grateful that they saved his life. But the debt is not $47,000 anymore. It's now $62,000, even though my client's been paying everything he can afford to pay for the last 2 years. And that, my friends, is why bankruptcy exists. And I don't have any problems being a bankruptcy lawyer. If you need some help, reach for the life raft. Reach for the life raft.
If you voted for Trump in his first term, you were a sucker. But if you didn't learn your lesson and you voted for him again, you're a loser. And the same goes for Republicans. You guys are solely responsible based on your vote for tens of millions of people losing Medicaid coverage, millions of people losing food stamps, and whatever comes out of rural hospitals closing because a majority of their funding was from Medicaid. That's your...
This is a direct accusation aimed at the consequences of certain legislative actions. The speaker is laying out a grim picture of widespread loss of essential services like Medicaid and the closure of vital rural hospitals. It's a strong assertion that these outcomes are directly linked to specific political decisions and the votes cast in support of them. The message is clear. Individuals and communities are suffering because of policies that, in his view, were detrimental. He's pointing to a direct causal relationship between political choices and negative impacts on people's lives. This perspective challenges listeners to consider the tangible effects of legislation, especially on vulnerable populations and essential community infrastructure. It's a call to hold elected officials accountable for the outcomes of their policy initiatives, and to understand that these aren't abstract issues, but deeply felt realities for many.
And it's not just rural hospitals, but it's going to be predominantly poor areas where there's rural hospitals who received Medicaid funding. That is your fault. This is entirely your fault. That I'm not even calling it the big, beautiful bill. It's the MAGA bill. That's what it is. Live with it.
Breaking news. Rural health clinics are closing in the United States due to Donald Trump's big, beautiful bill. What? Yes. They altered the way Medicaid pays hospitals, and they were warned that this would close many rural hospitals and clinics across the United States. Again, news reporting again in CNN today that again, many clinics are starting to close across the United States. This is going to impact mostly MAGA. F around, find out MAGA. Your health clinics are going to close, and not only that, your Medicaid and your Medicare are being impacted. And likewise, if you get insurance from the Affordable Care Act under Obamacare, the subsidy for that ends December 31 too, and expect those prices to skyrocket. So this is all thanks to Donald Trump, and clearly not interested in protecting the health of the people in the country, because if they were, they would not have done this bill to give the rich and himself a massive tax cut. And we'll see with this tax cut that comes into play into the next year, who gets money and who doesn't. And the average little people and the middle people aren't going to get it. The super rich are going to benefit again. MAGA, FAFO, you did it again. Keep on voting against your interest. You know, you need to do something beside that R card. Love to hear from my Democrats and my MAGAs, my crazies, my cuckoos, and my burned out light bulbs. What do you think?
Yesterday I made a video about the repeal of the Affordable Care Act and the ACA. And the number one reason people gave is simply because Obama came up with it and it was called Obamacare. That's the reason. That's the reason they're taking your health care away from you, is because these people can't get over Obama coming up with something that actually helped people. This administration has only made things more expensive, and now your health care is more expensive. Somebody wrote yesterday that their premium went up 500%. You guys have had since 2017 to come up with a better healthcare plan, and you haven't done it. What's better, keeping this or nothing? Keeping the Affordable Care Act obviously is a better idea than screwing over 25 million struggling people. What?
This morning, somebody woke up after a cancer diagnosis and they're wondering whether or not they're going to have insurance in 3 months. They're gaming out whether or not they're going to be through with chemotherapy by the time that the January changes to premiums hit. Trying to figure out what they might be able to sell or if maybe they could get on GoFundMe. That is the reality that has been created because Republicans refuse to extend ACA subsidies that make insurance more affordable for people. And so it is causing folks right now this morning in America to look around and wonder whether or not they can afford to live. Will they cause their family to go bankrupt because their chemotherapy is $100,000 per infusion, but the premiums will be $2,000 a month? And they can't afford 100.
This is an incredibly raw and honest portrayal of the fear and desperation people are experiencing. The speaker is describing the agonizing calculations individuals have to make when facing serious illness and rising healthcare costs. It's about the impossible choices. Can I afford chemotherapy? Can I even afford to keep my insurance with these sky-high premiums? What do I have to sell? This is the human cost of a healthcare system that seems more focused on profit than on well-being. The anxiety of a cancer diagnosis is compounded by the financial terror of affording treatment, and the fact that people are contemplating selling assets or going to crowdfunding just to survive is an indictment of our system. This isn't a hypothetical situation. These are real-time decisions with life-altering consequences. It paints a picture of a system that is failing its most vulnerable, forcing them into impossible financial binds, and it's a testament to the profound stress and emotional toll this creates.
$100,000, but they can't afford $2,000 a month either. Friend, these are the real life decisions, the real life internal conversations that people are having right now. And it's all because Republicans refuse to extend subsidies that make it easier for people to live with dignity and with the health care that they deserve. You know, I'm sick and tired of pretending that Republicans care. They don't care. I want them to change my mind. I am begging them to change my mind. Show us that you actually care about the American people. I do care about the person who got a cancer diagnosis yesterday and who today is wondering whether any of us, anyone, is on their side and is fighting for them. And friend, I am. I see you, I know what you're going through, and I'm so sorry. And I'm working really hard. I got your back, friend. I got you.
I'm trying to not crash out right now. For context, in January, the Trump administration removed a rule that the CFPB put in place that would remove medical debt from credit reports. This is now taking it a step further and saying, no, if you're a state and you made a state law, which about 15 of them have, to try to make protections for patients in removing medical debt from credit reports, you can't even do that. Those are going to be overturned. I have never met a Democrat or Republican that thought that removing medical debt from credit reports was a bad idea. This is about as bipartisan as it gets. Nothing says land of opportunity like telling a cancer survivor that they can't.
This is a critical piece of information that needs to be widely shared. The speaker is highlighting a disturbing trend where medical debt is being used to deny people basic financial opportunities like getting a mortgage. This is particularly egregious when considering individuals who have already overcome significant health challenges like surviving cancer. It feels fundamentally un-American to penalize someone for seeking life-saving treatment. The point about debt collectors benefiting is stark, revealing a system that seems to prioritize financial recovery over human dignity. This isn't just about credit scores, it's about the ability to rebuild and move forward after a medical crisis, and the suggestion that hospitals should be screened for financial assistance programs before bills go to collections is a common-sense solution. It emphasizes the need for transparency and fairness in the medical billing process. The advice to check for charity care is practical and empowering, giving people a tool to navigate a complex and often cruel system. This is about reclaiming some control in a system that often feels designed to exploit.
Get a mortgage because they chose to get chemo. Who benefits from this? Literally the only people that benefit from this are debt collectors. We hate collection agencies. Everyone hates collection agencies, yet that is who Trump is siding with right now. Medical debt does not belong on credit reports, period. If you have a hospital bill, before you panic, before you pay, check to see if you are eligible for hospital financial assistance, hospital charity care. Hospitals are legally required to have these programs. Most of them don't tell you. We do. We're a nonprofit. We do it for free. Go to $4.org, see if you're eligible. If the system insists on being cruel, we have to find ways to fight back. And this is how we fight back. We crush medical bills for free because you know what? A lot of these medical bills on your credit reports shouldn't be there in the first place because hospitals were supposed to screen you for these programs.
So there you have it. A stark look at the reality of medical debt and its crushing impact, especially when coupled with political choices that overlook basic human needs. We've seen how policy decisions ripple through communities, impacting everything from hospital access to individual financial futures. It's clear that the current system is failing too many, forcing impossible choices and creating cycles of debt. The good news is there are people fighting for change and resources available to help navigate this crisis, like checking for hospital financial assistance. What are your thoughts on this situation? Have you or someone you know experienced the devastating effects of medical debt? Share your stories and ideas in the comments below. If you found this video informative, please like and share it, and subscribe to Mind Mirror for more in-depth discussions. We'll see you next time.